Aloha, my name is Dr. Kanani Dilcher, and I'm from the Hawaii Island Family Medicine Residency Program. I'm also a family physician here in the Hilo community working for Hilo Benioff Medical Center. I'd love to invite you to join me on a journey through cancer survivorship, focusing in on exercise, nutrition, supplements, mind-body connection, social connection. Those are a few of the topics to look forward to as we journey through cancer survivorship, and I hope you join me here. Thank you. Aloha and welcome to the Hilo Benioff Medical Center Cancer Survivorship Series. My name is Dr. Kanani Dilcher. I'm so honored and blessed to be here today to share some of my knowledge with you all on cancer survivorship. I'm super excited about this talk today because I'm an athlete, and I think physical activity is so important both before your cancer diagnosis, during, and then afterwards. My father is a cholangiocarcinoma survivor. He survived a Whipple procedure. He went through chemo and radiation treatment, and then he went through high-dose chemo. No one told him to exercise during this process, and now he's laying at home in bed weak, and he won't move. And I'm trying to get him moving, and I wanted to know what to do, so this talk was pertinent. So thank you for being here today. I recently did a 3-year fellowship at the Andrew Weil Center for Integrative Medicine. I'll be sitting my boards in May. It was an incredible fellowship in that it gave me new light on how medicine should be. Opened my eyes to the bigger picture, and this is one of the topics in that picture. So I wanted to share that hula is actually a simple way to exercise, and very pertinent as it connects you to yourself and your body and reminds you our culture here in Hawaii. So keep in mind hula is a simple exercise, and it has a social connection as well. So what are these physical activity recommendations for cancer survivors? There's several groups that chip in on these recommendations. In the fellowship, we focused on the National Comprehensive Cancer Network. Basically, it's the same as everybody else, surprisingly, 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic exercise. Don't worry, you don't have to do 150 minutes to start with. You can start simple and build slowly over time, but this is our goal. And so you don't have to be afraid of exercise. It's not going to hurt you. Additionally, you should engage 2 to 3 sessions per week of strength and resistance training as well. So it's a combination of exercise. You can start slow, even in a chair. I start with Qigong every day. That's a nice, simple exercise routine. And then you can build up to resistance training and walking, hula, surfing. You can do it all. Additional guidelines, the American College of Sports Medicine has put out several consensus statements recommending the moderate intensity aerobic training. Again, 3 times per week for 30 minutes for at least 8 to 12 weeks. And they, too, emphasize that resistance training at least 2 times per week using 2 sets of 8 to 15 repetitions, 60% of 1 repetition maximum. So we don't have to worry about those small, minute details. The important thing is the frequency and the amount of time that you're spending and that you're doing it every day. Supervised programs have been found to be more effective. That's why I brought in Donna today. She's our expert. So I'm super grateful to have her here. The American Society of Clinical Oncology, or ASCO guideline, recommends exercise aerobic, resistance, or combination to decrease cancer-related fatigue in adults who have completed cancer treatment, with moderate quality evidence also supporting this recommendation. So across the board, all these organizations have found really good evidence for exercise. The ASCO Society also found that exercise during treatment led to increase in cardiorespiratory fitness, physical function, fatigue, and mood disorders, and also helped preserve strength, particularly in men with prostate cancer who are receiving the androgen deprivation therapy. So good news for all of us. Keep moving. The American Cancer Society now also recommends that survivors avoid inactivity and return to normal daily activities as soon as possible after diagnosis, aiming for 150 minutes of moderate or 75 minutes of vigorous aerobic activity per week, including strength training 2 days per week. It should be emphasized for women treated with adjuvant chemotherapy or hormone therapy. So you think of your breast cancer patients, very important for them, and there's a lot of biochemical processes at play there. How do you get going? So you need to tailor it to where you're at. You don't want to go run a marathon your first day out of cancer treatment. That would put you back in bed pretty quickly. Go slow, start slow, and build up slowly. I'm working on that myself, being inactive, doing my job, trying to get moving. I'm doing 20 minutes a day, and I'm doing a 7-minute exercise routine every day to try to get back to my strength level. Core exercise and balance training are very important for older survivors, especially with a fall risk there. All exercise, you should do aerobic warm-up and stretching. So stretch out those muscles. You need to be nice and limber. Do you have to move every day? Yes. Try to move every day, at least a little bit. Survivors really should avoid the prolonged sedentary behavior, sitting, doing screen-based activity, and really do movement breaks. I found out about all kinds of new phone apps if you're a technology type. I'm using an app. It's a stepper app, and basically it gives me little small exercise routines and reminds me to get up and go take a walk. And also just simple things like taking stairs if you can, a couple of stairs, parking further away, or jump in the ocean. We're so lucky we have the ocean here. So how do we start safely? The National Comprehensive Cancer Network gives a very structured approach if you want that. They say that if you're nervous about starting exercise, you can reach out to your clinician. Your family doc would be a good start, or your oncologist, your radiation oncologist, and they can direct you in the right direction. But really you want to look at your current exercise behavior, as I mentioned earlier, and then build from there. So you can classify whether you're meeting the recommendations at that point and slowly build up your routine. If you're not meeting it, you can give an exercise prescription. So 1 to 3 days of light to moderate exercise, aerobic like walking, with some resistance training built in, that time goal of that 150 minutes per week as the end goal. Do I need to be cleared by my primary care physician to get started? Most people know. But if you've had major abdominal surgery, if you have lymphedema in the case of breast cancer, if you've lost a limb through cancer treatment, if your bone health is poor, then yeah, you might want to check in with your primary care provider. But basically what they're going to say is go slow and go easy and, do the resistance, do the aerobic, and go real easy as you're going along. It kind of goes into ostomies and severe fatigue ataxia, but basically the guidelines are going to be get moving and support yourself in nutrition. And if you're not feeling it, then check in with your provider. What are the benefits? Oh, so exciting. So I dug into the research. There's a lot out there. The really cool thing is your immune system gets upregulated when you exercise. So there's these things called natural killer cells, and it stimulates those guys to get you going. And so the long-term benefits are huge. It improves your overall quality of life, reduces recurrence, and actually reduces death. So in the case of my father, whose chances of reoccurrence are quite high, and his chances going into the cancer were quite low, I'm trying to push him every day. Hey, Dad, go take a walk out to the mailbox, because guess what? Your 7% survival rate is going to go up a little bit, and I love that for you. It's a class 1 recommendation now for cancer-related fatigue to get exercising. Doing exercise during treatment, you really should look at kind of all the other risk factors. So METs, thrombocytopenia, low platelets, anemia, fever, those sorts of things. But really the big picture is move a little bit every day. You'll be safe. You'll be safe. There's this thing called cancer prehabilitation, kind of a cool concept. So basically when it's deemed unsafe or impractical for a survivor to participate in a home exercise program, you can go to skilled therapy like PT or OT, and they can do something called cancer prehabilitation. It might be helpful in newly diagnosed patients just to get them over that fear. So what is it? It's an intervention that occurs between diagnosis and the beginning of acute treatment. And it includes physical, nutrition, and psychological assessments to get that baseline functional capacity and then provide targeted interventions. So really putting big picture together. So where are you at now with your physical activity? Where are you at now with your nutrition? And how do we get you moving in the best possible way? How is it done? Multidisciplinary. So really having a primary care provider, oncology, it's a teamwork effort with working with physical therapists, dietitians, social workers, patient navigators, all together. Really though, in looking at this, a true integrative provider, a family medicine provider, internal medicine provider, oncologist should have somewhere with all around this. And if they don't, they can reach out and get help. We may not have all these resources readily available, but in Hilo, actually we do. We're really lucky. We have a lot of community providers that can help us. And then they're delivered through supervised programs. We talked about unsupervised, but this is another avenue, prehabilitation, that has some of the supervision. Clinical benefits, we mentioned earlier, decreased mortality, decreased recurrence, and improved overall health in our survivors. Among breast cancer survivors, there was a meta-analysis, so multiple studies. They looked at breast cancer survivors and post-diagnosis exercise associated with 34% lower risk of breast cancer death and 41% lower risk of all-cause mortality, and then 24% lower risk of breast cancer recurrence. So that was a huge nationwide study where they looked at a number of different situations, and that's what they found. Another study, 2025, 80 meta-analyses, so where they took a bunch of different research studies and checked out all the facts in them, found that exercise significantly mitigates or takes care of adverse events associated with cancer and its treatments, including cardiac toxicity, chemotherapy-induced peripheral neuropathy, cognitive impairment, and dyspnea. So overall, it's really helping us. In the same study, they also found that it modulates body composition and biomarkers. So looking at your muscle to fat ratio, your body composition, and looking at your biomarkers, so insulin, insulin-like growth factor, and C-reactive protein. So it helps to kind of regulate those things and get you back to a baseline, enhances your sleep quality, enhances your psychological well-being, your physiological functioning, social interaction, and improving overall quality of life. So really positive effects. And another systematic review of a lot of studies found that 75% of 140 different studies showed statistically significant, so it means it actually made a difference, beneficial effects of exercise for cardiovascular fitness and muscle strength, a little bit smaller for cancer-related fatigue, health-related quality of life, and depression. And then the incidence of exercise-related adverse events was only 3.5%. So if you look at that 75%, overall, in all these studies, really positive effects, and 3.5 had a little small risk of adverse events. So exercise, most importantly, should be tailored in those with neuropathy, lymphedema, and bone loss, like I mentioned earlier. In those folks looking at weight machines or resistant bands, so they're not dropping weights on top of their body, or going really light with higher repetitions would be good too. For head and neck cancer survivors who present with low skeletal mass and sarcopenia, exercise programming with nutritional support is important, right? Because you want to make sure you don't get weight loss and more wasting of the skeleton or sarcopenia. Opportunities exist throughout the continuum with exercise, and that's the best part about all this. We can adjust to you. These are my references, and I kept it short and sweet today because I really wanted to introduce Donna. So Donna is someone who works with cancer survivors and does exercise programming, and I wanted her to come on over and introduce her.
Hello everyone, my name is Donna. I am 36 years old, and I've spent the last 12 years of my life helping people connect to their bodies through fitness.
Late 2024, I was diagnosed with stage 2 triple-negative breast cancer. So I spent all of 2025 in treatment, both in chemotherapy and immunotherapy, and Rich reached out, and he is part of the exercise oncology program. He reached out to me as a patient, and I was basically a cold call. He was saying, hey, you were a patient here. Are you exercising? What can we do to support you moving your body and staying active? So when he explained that to me, I was really excited to hear, one, that there was a program, and two, I wanted to know how I could help and not just be someone receiving those services. So we started doing a group where we bring people together, anybody that's been affected by cancer, over at our studio. We've got a bunch of equipment there that's accessible to everyone, and we just take a little bit of time to move our bodies, but also to connect to each other, because I don't think everyone truly understands what you're going through, one, when you're in chemotherapy and treatment, and two, all of the effects that stay with you for a long time afterwards. So I'm hoping that I can help provide a space to just support, listen to people, get our bodies moving together. I'm definitely one of those people that needs a little bit of motivation. I'm not so prone to doing home workouts or things on my own. So if you have accountability and a place to be at a certain time, then we can all move our bodies together. One of the things that I got from people when I first got my diagnosis, I was open about sharing it with my community because I wanted them to know why I eventually was going to be bald. So I did get a lot of, you're so young, you're so healthy. And yes, that's true. I do carry the BRCA1 gene, and I lost my mother to ovarian cancer, and both maternal and paternal sides had breast cancer in our family. So sometimes you can take care of your body as much as you want, and cancer doesn't discriminate. It happens to people even if you're healthy. However, because I had a really strong foundation of taking care of my body, being active, and having a fairly good diet, I believe that carried me through my treatment so much better, so much easier. I was still able to teach classes, I was still able to exercise on my own, and I want to be able to share that with other people and help inspire them to keep moving their bodies for as long as possible. So I'm gonna just show us some really simple exercises, and this is something that I'm hoping people can take as a functional way to move, because these are everyday movements that we do, and if we do them with repetition when we're moving through life, this is just going to make it so that we're less injury prone and it feels more comfortable for us. So I will show us both the standing version and on the chair. And the first one is very, very simple. We just start standing, and it's a little bit of balance and shifting weight from one leg to the other. So some of us might be able to march all the way up with one leg and with the second leg. And this is just gonna help us drive into the center of our body. I always like to start any exercise from the ground up. Sometimes energetically that feels really nice. And for our next one, it's going to be a standing squat. So again, you can just find a stance that's comfortable for you. You're gonna drop the hips down and back, bending at the ankles, knees, and hips. Try to keep the core engaged, and then you're gonna power up through the bottom of the feet to lift up. Some of us might have a really nice deep squat. We might just start maybe with a 4 or 5 inch squat. And again, this can be done with the support of a chair or a table, something to hang onto. And then you can also do this in reverse. So if you have someone nearby, or if you have maybe a table or something out in front of you, you can lean forward, press through the legs to lift up, and then you can safely sit yourself back down. So these are all kind of variations that we'll give when we're meeting together in our group class. And the next one is gonna be working more through the rotation and center of the body. So I like to find a nice big wide stance. This also helps introduce some opening of the hips. And we just bring our arms out to a nice big T, and then we can start to twist just right to left. And you can see what it feels like to start from just the arms. Maybe just the arms are kind of moving. And then maybe you integrate the rotation that happens in the spine. And then maybe we work down into the hips, and you let the hips rotate with you. And all the movements that we're doing, we just want to really connect, and we're not just mindlessly like, okay, we're doing the exercise. We really want to think about the intention of where our body is moving in time and space. And you can add in a fold and twist if you have that flexibility. And this can also be done on the chair. We can twist and rotate. Okay, so our next one is going to be a lunge. And I always recommend, if you do feel a little shaky with balance, that you hang on to something that's nearby. When we're working on the single leg, we want to think about which leg is working a little harder. So with our lunge, we can hang on to something, even a wall out in front of us, and we just drop through the back knee and find a lift. We lower and we lift, and we can go on the other side. And all of these movements can be done with a resistance band, so you can put the band over the knees while you're marching, while you're squatting and lunging. Our next one is just gonna be a nice overhead press. I'll show it with the band so that you can see where some of that resistance training happens. So you can find a little bit of resistance in your band, and you're just gonna press the arms overhead. And if you do have any shoulder stuff going on, out in front is great. It doesn't have to be directly over the head. So we can press overhead. We can also add in a little bit. Maybe we wanna roll back, activate some of the back body and the chest. And then you can also press straight forward. Sometimes that feels best for us, just finding the extension of the arms. And that is some simple exercises that you can do.
Our next meeting will be advertised on social media. We'll also be on the Hilo Benioff Medical Center webpage, and then in the paper as well. Thank you so much for everybody's time. Happy to be here today, and look forward to our next session. Mahalo.